In a sad turn of events, the doctor leading the fight against Ebola in Sierra Leone has contracted the deadly virus himself. 39-year-old Sheik Umar Khan, hailed as a national hero by the health ministry, was leading the fight to control an outbreak that has killed more than 200 people in the West African country. Khan, a Sierra Leonean virologist, has been transferred to a treatment ward run by medical charity Médecins Sans Frontières. AIDS activists say as the working population changes, the workplace needs to adapt to the HIV/AIDS crisis. Statistics from UNAIDS show that the vast majority of AIDS patients are of working age. Many organizations, including the UN's Labor Agency, have called on businesses to create HIV-friendly policies for the workplace. Some nations, such as Australia, which is currently hosting the International AIDS Conference, have proactive federally funded workplace programs and progressive policies. But in other nations, particularly within sub-Saharan Africa, which has the world's highest AIDS rate of about 4.7%, working with AIDS is not always easy, partly due to discrimination. And tackling the AIDS epidemic over the years has been a great challenge for experts around the world. However, important research and discoveries are enabling tremendous progress in the global fight against HIV/AIDS. For more on HIV research, we are joined via Skype from South Africa, Johannesburg, by Professor Helen Rees, Executive Director of Wits, Reproductive Health and HIV Institute at the University of Witwatersrand. Professor Rees, welcome to Africa 54.
Thank you for having me.
First of all, when it comes to HIV research, a lot has been accomplished over the years. But presently, in your work, what do you think the emphasis should be, the focus should be?
Well, I think the first focus should be that we should be implementing everything that we already know. We've seen an enormous increase in the numbers of people going on treatment, which isn't only good for individuals and for communities, because we're not seeing the numbers of young people dying. We're still seeing a lot of young people dying, but not in the same numbers as before we had access to treatment. But also it's good for prevention. The more people that are on treatment, the fewer the people are in the community that can spread HIV to uninfected lovers and friends. So that would be one thing that I think we should really emphasize, but also the prevention measures. We've got a lot of things we now know work. For a long time, we were depending only on condoms, and those are really important, but we also know a lot of people can't or are not in a position to use them. But we've got access to things like medical male circumcision. We know that if you use antiretrovirals, you can stop yourself becoming infected. We know that if we treat sexually transmitted infections, that is really good. But we also know a lot of other things that will also stop infections. And those are not things around technology. Those are things about poverty and development.
So we have all these measures that we know that could work and have worked in many cases. But what is still lagging in terms of really curbing this HIV/AIDS pandemic and being able to reach that 2030 targets? There are still some challenges out there. Many of them, actually.
Yes, major challenges. And if we take our foot off the pedal, we're not going to reach a 2030 target. We have to really sustain incredibly intense efforts to really reduce and get on top of this epidemic. I think the challenges are some very basic things like the state of health services in sub-Saharan Africa. I mean, our services battle anyway, and if you put a new epidemic on top of them, which we've done in the last 20 years in this region, it's made things much, much worse. So we've got services that are already struggling, we have lack of infrastructure, and we have lack of money and funds very often, and lack of healthcare workers. So there are those basic things. But I think in terms of political effort, South Africa has been really fortunate. We've been led now by quite a visionary health minister. But if you see what's happening in other parts of the region, the same can't be said. And you have to think not only about health services, but you have to think about the framework in which we're trying to access people to both prevent HIV and treat HIV. And if you have the sort of frameworks where people who are at high risk of HIV are not coming forward, such as we've just heard from Uganda, yeah, that's a big problem.
Unfortunately, that's all the time we have. We have to leave it there. Thank you so much for joining us today.
That's a pleasure. Thank you.
And that was Professor Helen Rees. She's with the Wits Reproductive Health and HIV Institute. She was joining us via Skype from Johannesburg.